Welcome to Mobile Medical Media's review of ultrasound diagnosis of pneumothorax. This tutorial reviews how to identify pneumothorax. A 32-year-old man is a victim of a motor vehicle collision. He arrives with a GCS of 7 and loses pulses immediately after intubation. You must identify the source of his hypotension and treat him quickly if he is to survive. Whether traumatic or spontaneous, a pneumothorax is potentially life-threatening. Physicians are often called upon to recognize and treat pneumothoraces immediately. In a normal person without a pneumothorax, the visceral pleura of the lung slides on the parietal pleura of the chest wall. Pleural sliding is visible on ultrasound as scintillation or movement at the interface of the visceral and parietal pleura. Pleural sliding can be confirmed using M-mode and color Doppler. Comet tail artifacts, also known as B-lines, are echogenic reverberation artifacts tapering from the pleura into the far field, indicating the absence of a pneumothorax. In a pneumothorax, air separates the visceral pleura from the parietal pleura, so there is no pleural sliding, no B-lines or comet tail artifacts, and no evidence of movement on M-mode or Doppler. With the patient supine, a linear, convex, or phased array transducer is placed longitudinally in the midclavicular line, and the pleural interface is scanned in multiple interspaces from the clavicle to the diaphragm. Depth and gain are adjusted to optimize imaging of the pleura. Though not required, M-mode and/or color Doppler can be applied as needed to confirm movement. The exam can also be performed with the probe in the mid-axillary line. In a patient with a normal exam, absence of a pneumothorax is demonstrated by visualization of pleural sliding, presence of comet tail artifacts or B-lines, and evidence of motion on M-mode or Doppler. Using M-mode, movement at the pleural interface and beyond is indicated by a granular appearance that is distinct from the linear laminar pattern of the stationary chest wall. This negative M-mode exam is sometimes referred to as the seashore sign. In a patient with a pneumothorax, no pleural sliding or comet tail artifacts are seen. The M-mode tracing exhibits the same laminar linear pattern at the pleural line and beyond as seen in the stationary chest wall. This positive M-mode exam is sometimes referred to as the stratosphere sign. Your motor vehicle accident victim becomes hypotensive immediately after intubation. An emergent ultrasound examination confirms your clinical suspicion of a pneumothorax on the right side. A chest tube is placed and the patient's blood pressure improves. Pleural sliding, comet tail artifacts or B-lines, and motion on M-mode or Doppler indicate the absence of a pneumothorax. A true pneumothorax is indicated by the absence of pleural sliding and comet tail artifacts and the absence of motion on M-mode or Doppler.